I'm Anatomical and I'm a rheumatologist. In this talk, I will present the simplified anatomical concepts for sonographic examination of the elbow. The examination of the elbow is focused to the structures based on the clinical impression, but for the purpose of learning, the sonographic examination for elbow is conducted from the four different views: the anterior, posterior, medial, and lateral views. Let's look at the anterior elbow. This picture shows the landmarks seen on the examination of the elbow from the anterior view. Notice the rounded capitulum and a pulley-shaped trochlea at the lower end of the humerus. Also, notice lateral and medial epicondyles projecting from the lower end of the humerus. A shallow radial fossa proximal to the capitulum and a coronoid fossa proximal to the trochlea. Distal to the joint line, you see the head, neck, and tuberosity of the radius, and on the medial side, you see the coronoid process and tuberosity of the ulna. Let's look at some of the soft tissue structures of anterior elbow. The brachialis muscle occupies the major bulk of tissue seen on examination of the anterior elbow. Biceps muscle and tendon is located superficial to brachialis muscle. On the medial side of the biceps and brachialis, identify brachial artery and medial nerve. Also identify radial nerve located on the lateral aspect of the anterior elbow between the brachialis and brachioradialis muscle. The important skeletal landmarks on the posterior aspect of the elbow are medial and lateral epicondyle and a deep olecranon fossa which is occupied by the olecranon process of ulna during the elbow extension. The main soft tissue structures on the posterior elbow are the triceps muscle and tendon, the ulnar nerve coursing along the medial border of the triceps, and the olecranon bursa, when present, will be seen superficial to the olecranon of the ulna. The other important structure you want to identify both on the anterior and the posterior view of the elbow are the synovial recesses. The synovial recesses are created by folding of the synovial membrane between radius and ulna, which creates three recesses. On a posterior view, you see the olecranon recess, which occupies the olecranon fossa. And on the anterior aspect, you have proximally the coronoid recess, which occupies the area both over the coronoid fossa and extends over the radial fossa. And the third recess is the annular recess, which surrounds the radial neck. And the fat pads lie between the synovial membrane and the fibrous capsules. They are intra-articular but extra-synovial. On the medial side of the elbow, ulnar nerve passes posterior to the medial epicondyle on the medial side of the trochlea as it descends to the forearm between two heads of flexor carpi ulnaris. Notice a relatively wide attachment of common flexor tendon to the medial epicondyle. Common flexor tendon is formed by the joint origin of flexor carpi ulnaris, flexor digitorum superficialis, palmaris longus, and flexor carpi radialis tendons. On the lateral side, lateral epicondyle gives origin to the common extensor tendon, which serves the common origin for extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris. Distal to the lateral epicondyle, you will notice humeroradial joint formed by the capitulum of humerus and the radial head on this side here. Let's look at some important ligaments of the elbow joints. On the ulnar side, you have the ulnar collateral ligament. The ulnar collateral ligaments consists of three bands. One is anterior, posterior, and inferior oblique. And you have some intermediate fibers which pass from the medial epicondyle to the inferior band between both anterior and the posterior bands. Anterior band provides the major constraint to valgus stress, and the oblique band is also known as a ligament of Cooper. And on the radial side, you have the radial collateral ligament. Here is your radial collateral ligament, which has no direct attachment to the radius. Proximally, the ligament is attached to the lateral epicondyle, and distally, it attaches to the lateral margin of the trochlear notch of ulna, and also to the annular ligament of superior radio-ulnar joint.